Ladies and gentlemen, welcome aboard the Pilot Lawyer Podcast. Thank you for your attention while this important legal information is reviewed. What you hear should not replace consultation with an attorney and should not be considered advice for your situation. On behalf of the Pilot Lawyer and your entire crew, it's our pleasure to have you aboard.
Welcome, aviators, to the Pilot Lawyer Podcast with us, the Ison brothers at the Ison Law Firm. We're here to help pilots and those who want to become pilots navigate the FAA Medical certification process. Of course, as we say around the office here, if you don't laugh, you cry. And for the next 30 minutes, we hope to bring you the lighter side of what can otherwise be a frustrating process. So whether you're laughing at us or with us, join us brothers as we discuss the fascinating world of FAA medical certification. Well, how was lunch?
Filling.
Some of the best.
Some of the best. Mexican today.
Mexican
today. Hot today. Wait, what is it? Chili today. Hot tamale. That's
and now that we've offended the rest of our listeners.
Well, it's just a little joke about bowel digestion. Well, anyhow, today here we are to talk about skin cancer in the FAA. Skin cancer. That's a crazy one, huh?
No,
you didn't think I was going to say that.
That's a post-lunch topic that is ripe to get me riled up.
Yeah, that's Christopher came off of his seat.
Colonoscopies would have been another good one.
What do you do that? You start doing those at age 50, or are you raring up for
next month? I don't know.
I really feel like it'd probably be something I just wouldn't do.
I think prep is what is the most unattractive about it.
I don't want to be put out. I don't want to be
probing.
I don't want to be. I don't want to be put under. I can't. I think honestly, if it life or death, I'd probably just.
I saw some meme
death.
where some woman was saying, this is the shirt my mom wore to her colonoscopy. And it was a picture of some aliens, and it said, "Get in, losers. We're gonna do butt stuff." I thought that was kind of funny to wear that.
That's crazy.
Here's a question for you, Anthony. Just because you're so adverse to anything, really, would you rather do the colonoscopy or the Cologuard, where you had to collect your own sample?
I'd take my own sample 100 days over. Okay. I would do that in a heartbeat.
Got to be a clean catch.
Not a problem. As long as I'm awake. I can't. I mean, what if the worst?
They find something?
You've been put under. Well, no, I mean, you don't wake up.
So when I had my appendix out here recently, randomly.
That was
You're
a year
welcome.
ago.
No, it's like 2 years.
2 years ago.
Almost 2.
Oh, wow. I remember you were chugging that Pepto-Bismol that day, and that didn't seem to work.
Surprising, it didn't help.
Yeah, but, I mean, I like it. Because
it's like Pepto-Bismol or the appendicitis?
No, well, the being put out, because it's like you go to sleep and you wake up, it's all done. You didn't have to sit there. See, I think you would actually enjoy it. Like, obviously, there's the nervous anticipation, the anxiety, but they're going to give you stuff for that anyhow to mute that effect.
Not in time.
Yeah. Well, give this big boy a double dose. But then you just, next thing you know, boom, you're asleep, and then you wake it up.
I don't like that. I don't like that.
Yeah, well, but see, if you die, you won't know. Because you're asleep.
Would you rather, I mean, not to get grim, but would you rather know you're about to die, or would you rather just die? Like,
just let it happen.
I don't know. That's
I'll let you know.
That's a real metaphorical question there.
Yes, sir.
That's above the pay grade of this podcast.
Yeah. I don't know.
I'll be honest with you. They put me in when I dislocated my shoulder, they put me in this twilight to like put it back in. And that was the best stuff. I tell you what, I came out of it and I didn't know.
I think I'd hate that even more.
Well, I was asking them for a dose for each of my kids because it was.
I'm afraid to go get my wisdom teeth out because, they're coming in, instead of vertically, they're coming in horizontally. And I went to the dentist the other day. And he said, "Does that hurt?" I said, "No." And he said, "That's what you say." Yeah, that's what I said. They don't hurt, but they don't hurt. They're literally pushing all my other teeth into each other. So
not very smart for wisdom teeth to come in.
I refuse to go get knocked out. Well, I guess I could do it standing up, without the knockout, but I just can't do it.
Hit in the head with a brick.
Yeah, it's true. It's Three Stooges style. So you just stayed out in the sun. Well, here's another little anecdote. we could talk about Bo. Now we're on the skin cancer. Skin cancer.
You're going to put your child's protected health information out there on the internet?
The poor little guy, 4 years old, came up with staph scalded skin syndrome. He's in the hospital for several days and had to have antibiotics, and then went to the doctor after he was out of the hospital. He said, now that we're on the other side of it, I can tell you that was really bad. Well, you couldn't tell me that while we were in the hospital with him?
I don't know if I can trust anything that guy ever says ever again.
Yeah, it's like, well, everything he tells us from now on, you just kind of have to escalate it by 5 or 10.
Well,
but we were sitting in the hospital with him, and I thought, you know what? Skin cancer podcast. Because I thought, nobody's talking about this. But I have seen cases many times.
Way to turn your child's misery into a business.
I'm trying to help.
See that listener always thinking about your case.
Got that hospital bill we got to look at. But we have seen quite a few skin cancer cases, and it's something that that's quite common, and it's something that the FAA will inquire about, which we'll talk about more in today's cockpit conundrum.
Oh boy!
But nevertheless, so what do you think on the? There are a few cases with skin cancer that will warrant deferral by your AME, and certainly some cases that can be authorized for issuance. But these are cases where you'll always want to have some documentation as you go to your aviation medical examiner and examination to establish that you meet the criteria for that of which doesn't require deferral. So in other words, you want to be able to establish that, if you can, that your case history is appropriate for issuance. So the FAA does have a disposition protocol for skin cancer that I thought we could walk through it.
I think at the outset it should be noted that cancer in general, skin or otherwise, is not a specifically disqualifying condition. Like, you're not going to look in the regulations and see anywhere where the word cancer is even referenced, right?
It's an interesting thing because the medical application doesn't even ask about cancer. It's going to ask about all these things, but cancer is not a question that we're going to ask about explicitly.
Despite the fact that a lot of people
had cancer.
It takes a number of people each year, but we're not going to ask about it.
Yeah, that's not a question.
We're not going to.
We are going to ask about stomach trouble, but we're not going to ask about cancer.
We'll ask you about...
it's not to say you don't have to report cancer. It's just that you have to read between the lines, and that it's at question 18X.
Well, you could read that line.
Yeah, you could read that line. Other illness, disability, or surgery. Now, I'm sure most folks with cancer are going to say, yeah, I've had some sort of illness and maybe even a surgery, and that when they see 18X, that's going to prompt them to say, yeah, I need to put this down because this was a major medical event. But 18X will trigger a response. Sometimes you're taking a medication that will be triggered at 17A, where it asks about current use of medications. There may be something as it relates to visits to healthcare professionals you have to put down in 19. So cancer is going to come out on the medical application.
If you're doing it right.
If you had it and you're doing it right on the medical application. So as it relates to skin cancer, the FAA has sort of a protocol that they like to see.
Well, wait, hang on, though. Okay. You're not setting up the foundation, though.
Back it up.
The idea here is that since cancer is not a specifically disqualifying condition, it's only disqualifying at the discretion of the federal air surgeon, in which case, based on the case history and appropriate qualified medical judgment, the federal air surgeon would find your history makes you unsafe to operate an aircraft, right?
That's right. Yeah, that's right. So it's not like they just had to say, boom, you have skin cancer, you're out.
Yeah.
They have to show that it's going to potentially cause a risk to aviation safety.
And so while we should certainly talk about the things that you need to, send to the FAA per the little guidelines.
Little scrap of paper.
But the idea there is that, let's say you provide what we're about to go over and it's all favorable, and yet they come back and still deny you.
Well,
now, because it's discretionary, you can go to the NTSB on a petition
or you could ask
review.
for reconsideration.
Well, yeah, you got to do that before you get to the NTSB. But the point is, there's lots of forms of redress. Okay.
Redress? You stay dressed. That's all I have to say. So So yeah, I mean, it's like if you're able to fly safely, what can they what can they say?
Well, I mean, as long as you got the qualified medical judgment on your side and your case history, I think the question is one of stability. What's the likelihood of recurrent symptoms?
Yeah,
Is it going to put you at a greater risk to aviation safety than the general public?
I think that
those are the questions you're trying to answer.
Sort of
here.
metastasis, I think, is a question as well. Is it going to cause something that is problematic otherwise?
All right, so kind of give a little bit of a background on what the thought process is there relative to the regulatory requirements. Now you can get into it.
All right. Well,
now that you've
stand by.
Okay,
so
to a different page.
The protocol is as such. If you show up to the AME's office and you have a skin cancer of unknown pathology, Alex, what does that mean? Unknown pathology.
I'm sorry, I was miles away.
Unknown unknown pathology. What is that? What's that mean?
Just didn't know the origin of it. It wasn't like
It's like from Seinfeld. Never seen that before.
Never seen that before.
Okay, if you have an unknown pathology, stop. Yet the FAA says if the AME's unable to verify pathology, the airman needs to collect all the medical records to include those which include diagnosis and treatment and pathology reports. Once you have those reports, you can proceed. They won't even let the AME, in theory, under this protocol, they don't even want the AME doing anything until they know that. Defer or issue. So that's an important thing to have before you even consider making an appointment with the AME, is all your medical records as it relates to diagnosis and treatment and the pathology report. All right? So that's ab initio, if you will, right? Is that the right word? On your own, spontaneously, you should have those records before you go to the AME, because the AME can't look at your skin and say, hey, you have
looking good, Jack.
Yeah. So
you got a real glow.
Okay, so let's say you get the documentation and you had either basal cell cancer or squamous cell cancer, BCC or SCC. And it was uncomplicated. Skin only. No organ involvement. Okay? No organ involvement. If the AME can interview you and examine findings consistent with uncomplicated local BCC or SCC and is completely treated, it's excised, destroyed, or otherwise resolved, then, and only then, the AME may issue the medical certificate and note on block 60 that you had BCC or SCC. Now, Christopher or Alex, open this for discussion. How can we aid the AME in potentially coming to a conclusion that it is uncomplicated and was completely treated? What could we do?
You could walk in there with a detailed clinical narrative from your treating physician outlining the treatments that you have, any current medications, your risk for recurrence of symptoms based upon your history, and you can hand that to your AME with a little bow on it, and
yeah, I mean, so
they'll love that.
That way, the AME's discretion. If they say, well, I'm not a dermatologist, I don't feel comfortable with this or whatever, I'm just going to defer it and let the FAA figure it out. Such a letter, as Alex describes, could very well help assuage any concerns that the AME has.
Do what?
Assuage, Alex. Look up assuage.
I use that all the time when I'm talking to people on the phone. I don't know if I know what I'm talking about, but I don't know if they know what I'm talking about.
You're not going to assuage your own interest. Yeah, you look that up, Alex. So
assuage, make an unpleasant feeling less intense.
Oh
man, there's so many
using that maybe incorrectly. Assuage. So this is kind of unpleasant, and it's making me feel better, right? So
an opportunity occurred to assuage her desire for knowledge.
I don't know where
that came from.
So you've assuaged the AME's concern, they can issue. Okay. Now we've got something that's a little bit more involved.
Pacify or appease.
You know a lot about that from your home life.
Sure. But
And you don't?
I mean, the whole to lessen the intensity of something that pains or distresses. I think that all can be said for our home lives.
Yes.
Yeah.
Especially at the dinner table.
Anyhow, so I still think we're using it right.
I think it's beautiful.
Yeah.
Okay.
Has your FAA medical certificate been denied? Are you concerned you may not be able to get a medical certificate from the FAA? Are you at risk for FAA action for failing to report your medical history appropriately? Call the pilot lawyer at 1-855-FAA-1215 to discuss your options for getting the FAA to issue your medical certificate and get you flying. We are happy to evaluate your case and discuss with you a plan for presenting your case to the AME or the FAA. Aviation law is all we do, nothing else.
SCC or BCC, complicated lesion, metastatic lymph node or deep tissue involvement, aggressive pathology, or other abnormalities. In this particular situation, we have an issue as it relates to potentially getting deferred, likely getting deferred. You're getting deferred. What the FAA is going to want to see are medical records describing the diagnosis and treatment, pathology reports, operative reports, current status summary report that includes current or planned future treatment and prognosis, and copies of any imaging performed, such as CT or MRI. So this is a situation where we have individuals who may have had some metastasis and would potentially put you in a spot where, you need to be able to identify that this is not going to be a problem downrange and that the prognosis is effective, right? Now the FAA is going to put you on a special issuance, more likely than not, for this situation to be able to mitigate or monitor that risk.
Do you think the likelihood of having additional reportable diagnosis kind of related to this, such as like, oh, they put me on some Lexapro or something like that to help me through this time, especially with the complicated cases?
Goodness. That's an interesting thing, yeah. So if you're off the medication and you can sort of demonstrate that this was situational in nature, that could potentially put you into the anxiety or the depression fast track, right? So there are some considerations that if you've had some sort of diagnosis or treatment for situational anxiety as it results from maybe the skin cancer treatment, that's something you have to consider as well. Excellent thinking, Alex.
Hey.
Good thinking today. So then you got the melanomas. This is probably a bit more common. Melanomas that are less than 0.75 millimeters in depth or melanoma in situ. Look up in situ and where that came from. We all know what it means. I know what it means. It means it's sitting right there. Hasn't moved.
It's
Sounds like
there.
me.
Sitting, waiting to sue.
What they're going to want to see there again.
It's Latin for in the place, refers to an artifact that has not been moved from its original resting place or place where it was deposited.
This is going to require medical records describing the diagnosis and treatment and pathology reports. Again, on this one, interestingly, the AME is allowed to issue if completely resected with clear margins, no recurrence, no metastatic disease, and favorable reports allowed to issue. So you're gonna want to go into the AMEs again with a letter, even though it's not identified in the protocol. Having a letter that's able to demonstrate that it was completely resected, clear margins, no recurrence, no metastatic disease, favorable reports in general, that's going to be helpful to you by all means. Now, if you have a melanoma that's equal to 0.75 millimeters or greater in depth, the FAA is going to require deferral. And the FAA is going to require medical records describing the diagnosis, pathology, operative notes, current status report that includes any additional lesions, any metastatic disease, any current or future treatment plan, and a current MRI of the brain. So they're wanting a brain MRI at this point with the melanoma, and that's going to require review by the FAA and a special issuance. You know what I think? I think it's time for a quick cockpit conundrum. What do you think?
Well, I think that's beautiful.
I've got
Spectacular. Give me 14 more.
I got one that's relevant. I got one that's relevant
That's a
here and
first.
one that's not relevant. Which one do you want?
Well, I think for continuity purposes, we should do the one that's not relevant.
Okay. Okay, this one's called The Quiet Cab Ride. The Quiet Cab Ride. You're a 38-year-old, a younger person, Christopher. You're a 38-year-old Part 121 first officer with a clean FAA record, good medical, solid training record, and a strong reputation on the line.
What is that? What's
I
a
don't know.
strong
I don't know.
reputation?
I don't know.
What does that even mean?
Filler. BS. You never crash and kill a bunch
An
of people.
impeachable character.
Yeah.
Okay.
After a dinner layover in Austin, you decide to have a few drinks. Well, you gotta lose. What's going on here?
He's no longer strong.
He's weak to the bottle.
All right.
Rather than risk anything, you take a cab back to the hotel and crash for the night.
That's that strong character coming out.
Just go out and drink and sleep. The next morning, your phone is blowing up. Turns out your buddy, another FO, first officer, that's in the
business.
was stopped while driving back from the same bar. Good thing you didn't ride with him. He was charged with DUI.
Sounds like a him problem.
Him or hims.
Oh! You weren't even in the... We're not making fun. Just enjoying.
If you can't laugh, you cry.
So you weren't even in the car, but a dispatcher tells you he mentioned your name to company security. What?
Come
What a
on.
narc.
Don't you know my strong reputation on the line?
That's why he's calling.
Well, just as you're boarding the crew van, you remember 7 years ago, before you even had your commercial certificate, you got a DUI in college. You completed all the court stuff and disclosed it properly back then. You haven't had any issues since. Now you're wondering, do I have to tell the FAA about this cab ride incident? And does my buddy's DUI trigger anything for me under 6115?
What happened in the cab ride?
Well, nothing.
I thought he just...
Well, the question, he got so blasted drunk, he had to take a cab home.
Yeah, but if you got that blasted drunk, it begs the question, did you really... how did you get in the cab? How did you have the mental...
Well,
that's
that's maybe not a good thing. Maybe that's not a good thing. Well, you had a few drinks, but
for sure.
yeah, you're feeling so intoxicated that I got to call a cab. Does that imply one of the substance dependence criteria of impaired control of use? That I drank more than I should have, more than I would have liked to have, perhaps, such that I need to get a cab.
How many drinks did he have in the sitting?
I don't know.
Sounds like more than 5.
I think maybe it should signal something to you interpersonally, to say, maybe I should cool it because I'm going to end up like my FO. And I'm going to get a DUI next if I'm not careful. Now,
Effed up like my FO.
Yeah. So praise God, though. You took the cab. You didn't go out and kill somebody for sure. But, so keep doing that.
Yeah, but this doesn't. If this were at, we're getting into this conundrum.
we're trying to come up with conundrums that's more difficult in this niche.
Some kind of crazy conundrum. But
It's more of a pickle.
if this were a one-time incident, though,
Yeah, I think it's
I don't
fine.
think-
There's nothing to report.
and he had something. How many years ago?
He had a DUI 7 years ago. Oh, I forgot about that fact. He had a DUI 7 years
yeah.
ago that he reported.
Yeah.
Now the question is, after you
should
get,
he have continued drinking?
Yeah, yeah.
What did he tell the FAA at the time of that?
That's a good point.
I'm not going to drink anymore.
Yeah, I'm not going to drink anymore.
Well,
The weeds are
now
getting thicker.
Here we are drinking. You know?
And I guarantee you, when he got cleared with that DUI, they sent him a letter saying, "Hey, any evidence of future substance use concerns? We might have to, revoke your medical."
Now you might have continued use despite impairment of social, personal, occupational functioning, which was a criteria for substance dependence. That
And
could
is it
be
going
on
to
the
come
table.
out to the FAA that he was out drinking with this guy by nature of the fact that, now, that's a question. It's a
Maybe,
problem.
I mean...
I don't think that's going to become a problem for him.
Yeah, that's kind of... his buddy getting the DUI, that's his buddy's problem.
He doesn't have anything to
his
report.
buddy needs to call us.
He doesn't have anything to report under 6115, though. He didn't do anything.
Yeah.
What about 6153?
Oh, boy. Well, does he know
how much more time we got on this podcast?
Does he know
'Cause
or
we
have
gotta-
reason to know of
we're
a
gonna get
medical
into it.
deficiency? Should he self-ground? Well, if he feels like, I mean, was this a one-off? Is this how he's drinking all the time? Because if this is how he's drinking all the time, maybe he should stop. If it's a one-off, you know, what's he going to do?
I'm beginning to think that this whole reputation for a strong reputation on holding the line or something.
Why are you so
That's
nervous?
a fictitious imagination or whatever.
Yeah. He's got a personality disorder.
DUIs. He's out carousing after his flights.
Bar crawl.
He's
And seemingly, he might even have an 8-hour bottle of throttle roll. The conundrum doesn't identify when his next flight is.
this guy might be more than a conundrum.
This is a heck of a problem.
Full-blown investigation.
Not to be.
This could be an autopsy. But I think realistically, though, he has nothing to report. The problem is going to be if he somehow gets wrapped up in his buddy's shenanigans, and if the FAA, I think this would be somewhat tenuous. But if they started, it kind of strikes me almost akin to like a hotline complaint. You know, even though this wouldn't probably come in as a hotline complaint, but I guess it's somehow how it could kind of trickle into like, oh, hey, we got information about this.
Well,
You think? I don't know.
Perhaps.
I don't think we've ever seen anything like that happen, but you know, we don't represent everybody in the aviation community.
we could. And that brings me to this point. He didn't report his skin cancer, which was a big problem.
Ooh, that's going to hurt.
Yes. So the last of the disposition for skin cancer is metastatic melanoma or melanoma of unknown primary origin. For these cases, the FAA is going to require info from the melanoma of greater than 0.75 millimeters protocol, as well as a PET scan and copies of any additional testing performed by your treating physician that might not otherwise be required. That will be submitted for deferral and considered, especially to ascertain the status of any other metastatic concerns. So if you have skin cancer, it's not something that you can just blow off and say, oh, I had that fixed, or that was resected. It is going to need to be something that's identified at question 18X at a minimum. And then documentation will need to be provided to the AME at the time of exam to try and avoid deferral if that's possible. So
Let me ask you this. So let's say you get all that, regardless of whatever the history is there, you get it all together, you got favorable documentation, send it to the FAA, you get denied.
yeah,
What are your options?
at that point, you could ask for reconsideration.
What's that mean?
I'm going to say, hey, you got this wrong. Look at this again. Perhaps you figure out what their problem was or why they denied you. Get new evidence to support your position that you're not a risk to aviation safety. You submit that and ask them to reconsider it. That's option one.
Okay.
Option two is you could petition the NTSB.
Well, you can't go straight to NTSB.
We'll
if
have
you
to get
denied.
that final denial. And then
And
I go to the NTSB.
doesn't that somewhat kind of contemplate having a request for reconsideration?
Yeah. So let's say I've done that. Now I can go to the NTSB and I can put on a trial. And I can bring evidence to establish that the FAA's decision was erroneous because I'm not a risk to aviation safety. These are going to be things like direct risk to aviation safety would suggest things like metastatic spread to the brain, neurological effects from treatment that's not disqualifying, visual impairment, pain or physical discomfort, and so on and so forth, or other diagnoses that are, as Alex had mentioned, that are correlated with the skin cancer, to include things like psychological impact, depression, anxiety, or distraction. So,
But they would have to deny you, though, on those bases as well. Would
on
they
those
not?
precipices, yes.
So, if that were the basis for
No,
their
they
denial.
could say that they're denying you for the skin cancer, and that's just kind of part of the rationale for denying you.
Yeah, but I don't know. That would seem somewhat tenuous. If, let's say...
Is tenuous
there-
the word of the day?
I think so.
I've heard you say it several times.
Well, you look it up on ChatGPT because that's all you practice by here is ChatGPT. No, but seriously,
I have
if they were going to
brain
say that you had a history of anxiety relative to your history of skin cancer, shouldn't they also deny you under 67, 107, 207, 307? I mean,
for mental health, yeah, I
Yeah.
would say they should. Why
And if-
don't you? Go ahead.
And if they don't,
But I'm going to say,
It
well, this
doesn't-
situational is related to the skin cancer that's resolved.
so therefore there's no risk for recurrent symptoms.
Yeah. So how is it problematic?
Well, that's what I've been saying.
Well, that's what I was trying to say.
Well, we're saying the same thing.
Well, you've squandered another meaningless half hour where you could have been doing something productive, like drinking with your buddies,
Drinking with the FO.
listening to the Pilot Lawyer podcast. And although our wives continue to deny us in public,
Deny us. They deny us. I would hope they would. Nobody wants to see that.
deny they know us in public. Excuse me. Yeah. They deny us in private too.
This is thepodcastfactory.com.